Welcome to Your Health is Wealth podcast. The podcast invites you to embrace the profound truth that your health is your wealth. I'm your host, Kristen Burke. This podcast aims to take you on a journey into the landscape of alternative medicine, integrative practices, and holistic healing options that empower you to thrive in mind, body, and spirit. Today in our segment titled, The Echoes of Trauma, Navigating Grief and Rebuilding Health Through an Integrative Approach. In this episode, we're going to explore areas such as PTSD, stress, and grief, where these are the silent battles waged within our minds, battles that often go unnoticed but leave significant imprints on our lives. During our discussion today, we're going to confront the harsh realities of mental health in America, a country grappling with uncertainty, economic instability, and a healthcare system strained to its limits. According to the data from 2022, roughly 50 million people in the U.S. struggle with some form of mental health concern. Shockingly, a significant portion of that number, 35 million, is attributed to issues such as suicide and drug addiction. But let's not be mistaken. These numbers have likely risen since 2022. The relentless pressure of modern life, compounded with societal and personal challenges, has created a perfect storm for mental health crisis. Economic downturns, social upheaval, and the erosion of support systems only exacerbate the situation. One of the primary drivers of this crisis is trauma, a deeply ingrained wound that festers within the psyche. Trauma, whether caused by a single devastating event or prolonged exposure to stress, leaves an indelible mark on our mental and physical well-being. It rewires our brains, distorting our perspective and coloring our interactions with the world. Grief, too, plays a significant role in this narrative. It is an emotional aftermath of loss through this journey of pain, anger, and sorrow. Yet grief is often misunderstood and overlooked, relegated to the nuances of polite dialogue. Grief demands to be felt, acknowledged, and understood. So where do we turn in the face of such overwhelming challenges? Are there systematic, effective ways to cope with trauma and grief? The answer is complex, as multifaceted as the human experience itself. Traditional approaches often focus on treating the symptoms rather than addressing the root causes. Medication may offer temporary relief, but it does little to heal the underlying wounds. Therapy provides a safe space for exploration, but it requires time, commitment, and often comes with a hefty price tag. But there is hope on the horizon. Growing research suggests that holistic approaches combining therapy with mindfulness practices, physical activity, and community support hold promise in treating trauma and grief. These approaches recognize the interconnectedness of the mind, body, and spirit, offering a path toward healing that encompasses the whole self. Hey, everyone. Welcome to Your Health is Wealth podcast. Excited to introduce our guests here today on episode 4. First, we have Dr. Mikel Harris and Dee De Leon, both supporting areas within the mental health sector. Dr. Mikel Harris has served in higher education along with community and hospital-based mental health programs. She currently works in private practice as a licensed psychologist and CEO of Harris Psychological Services, LLC, offering mental health support across the lifespan. Dr. Harris also provides training, education, and consultation to organizations around the globe, focused on an array of mental health themes. Finally, she's a co-founder of Bloomwell Partners, LLC, a consulting firm that equips corporate entities with skills necessary to afford grief-informed leadership and care within the workplace. Dr. Harris has been featured as a mental health expert on Fox 13 Memphis several times throughout the past 3 years and has published articles in many magazines and contributed articles as a mental health expert and within the Washington Post. Next, we have Dee De Leon. She is a national board certified and licensed professional clinical counselor who started her career working with foster children and high risk adolescents in the juvenile justice system. Her early experiences influenced her decision to open private practice in Mount Shasta, California, where she primarily focuses on treating complex trauma. It is Dee's hope to teach clients how to establish a healthy relationship with themselves and the world around them in order to live a long, happy, and fulfilling life. Prior to working in the mental health field, when Dee wasn't raising her family, she worked in finance and as an assistant executive secretary to an international company. So both guests are highly educated and well-rounded and have a lot to bring to the discussion today. You will be able to find out more about Dr. Harris and Dee's in the podcast posting to their website. Okay, so before we go further, let's first define what is trauma and what is grief. So let's start with you, Dee. Can you just give the audience an overview of how do you define trauma?
For me, and for most of my patients, trauma is based on any experience, perceived or secondary or tertiary learning of any situation that would cause extreme distress, incite fear, or create maybe nightmares, intrusive memories, difficulty concentrating, where there's a lot of dissociation and, flashbacks. So basically, that's what we're looking for when we're treating patients is to see how their life is being impacted by any salient experience that they may have had and how it's either contributing to their inability to function or creating an inability to function. Yeah.
Thank you so much. And Dr. Harris, how would you define grief?
Yeah, so I think in its most basic form, grief is a universal, natural, and normal response to loss. And very similar to trauma, it's a strong, emotional, overwhelming sensation for folks. And what's important to remember about both of these is that it's subjective, meaning that it's pertinent to the person. So, two people may experience a similar loss and experience very different emotions and reactions to that. But it is natural, it's normal, and it is universal for all of us.
Thank you very much. So, in your bios, there's a little bit of information as to why you got into these fields. But I'd like for you each to lay out a little bit more, expand on that information as to what interested you in the area of mental health and specifically with how you work with patients. We'll start with you, Dee, and specifically in the area of trauma.
Yes. So I grew up in the Midwest, and where we lived, there were a lot of low income, impoverished families. And then when we relocated to the West Coast, I found myself looking for a job when my children were in school. And so a friend of mine had been working with CASA, which is court appointed special advocates, and they represent foster children in the court system. And by doing that, it really opened my eyes to so many experiences that these children were having that were outside of their control, and that there weren't very many people who were really invested in the best outcome for the children. I think a lot of people had good intentions, but to be able to stay the course and really represent the children was difficult. So that's what prompted me to go to school to become a therapist, because I felt like in a system that's just trying its best to survive, I could be that one person possibly in their life that could create some kind of safety and comfort and help them develop the skills that they need to get through what they were experiencing.
You're supporting them, an advocate to show them that there's a way where they can feel safe again. And with trauma, it can be very devastating to, well, you're going to get into that as we move through the podcast. But yeah, you can start questioning our own safety within self and our surroundings. Dr. Harris, What motivated you to get into the field of specifically helping people walk through grief?
Well, first I'll say that I never in a billion years thought that grief and loss was going to be a specialty area. I actually started my career back in the 90s. Please don't do the math. Working with children with developmental disabilities and their parents. And what I didn't realize at the time was that those experiences were really preparing me. However, in December 2012, my mom died of stage 4 pancreatic cancer. And at the time of her death, for the years that followed, I realized that niche was not something that a lot of clinicians focused on. And so I sought out to really be what I needed at the time. I was working in academia and I decided to totally shift my career to focus on grief and loss and have been specializing and learning more about the field since then and subsequently have experienced additional losses. So the beautiful thing is I've been able to work not only professional level, but also as a grieving heart myself to offer a lot of grief education, empowerment, inspiration for others navigating the same path.
Thank you for walking us through that. And also with grief and loss, so you had that your own personal experience with that, with a loss of a family member, but there's other forms of loss that a person might feel, right? Do you have examples of other forms of loss that a person might experience?
Absolutely. Yes. So when people think about grief and loss, what comes to mind for most people is the death, the physical death of a person. However, grief is very broad, and that may be, as I mentioned in my early career, the death of a dream, the death of an expectation for one's life or the vision for their lives. COVID really educated us about grief in many different forms, getting out of our routines and sort of grieving normalcy, grieving what we thought was typical and routine. So there are many different expressions of loss, divorce, and the list could go on and on. The grief is very broad, and I think it's important as a grief and loss professional to really conceptualize this in a way that is broad for our client.
And with understanding trauma and grief, as you have clients or patients coming to you, you would have to first understand the ability to identify some of the underlying factors that contribute to their symptoms. So, is there a process that you have when your patients or your clients come to you when they're experiencing trauma on how you identify those underlying factors that contribute to symptoms?
Yes, yes, thank you. So when a patient first comes, or a client, we, like most providers, we do an extensive intake process. And I think that's just a layer. Most people who have experienced significant trauma typically don't walk in and unload it immediately. There are a lot of trust issues that also accompany trauma. So I think the most important thing to treatment is building rapport and making sure that the people who are in your office feel safe with you. I'm a big advocate for really empowering my clients so that they understand whether they're working with me or another provider, that they have a choice. And if at any point in their healing process they feel unsafe or uncertain, it is absolutely okay for them to identify or to switch providers so that they can continue the healing process. I always remind them that their healing is not about me, it's about them, and that we go at a pace that is tolerable for their system. I think that clinically we're taught to get in there and get all the information, but the reality is it doesn't work like that. Our bodies will prevent the healing to happen if we get flooded or overwhelmed. And so it's really important that we go at a very slow and tolerable pace for our patients.
So that leads me to another question. Dr. Harris, do you think that trauma leads to grief, or does grief lead to trauma, or both?
This is that chicken versus the egg. And I think that they are overlapping, right? So as people come in and have had traumatic histories, there's grief associated with those traumas. right? So, for example, if someone experiences um, sexual abuse from a historical perspective, they're also grieving the loss of innocence in some ways. And so they really are overlapping, which makes the discussion about grief and trauma so beautifully intricate and complex. However, I've never worked with a client who, even if they came in with a presenting problem of grief, that I haven't addressed trauma and vice versa. So they really end up being very similar, one and the same in many ways.
And so, how do you go about identifying the underlying root causes of grief with your patients or clients when they come to you?
Yeah. I love that Dee talked about this importance of safety and creating a really healthy foundation from which the person can share their story. Very similarly, I begin with that. Once that has been established, one of the things that I really love to do is spend some time talking about two different things. Number one is the person's culture. And I don't necessarily mean their phenotype or what we can readily identify as their ethnic background, perhaps, but really understanding how they have shown up in the world, how they perceive the world, right? And the family structures from which they've come that help shape how they show up in the world. So I think that's always important. And then also, I love to take a trip down memory lane. And so helping people from a chronological perspective go back to the beginning, because what I'm assessing as a clinician is where did that person begin to identify traces or hints of trauma and or grief? How early did that start? And then as they continue to chart the course of their lives, when did that show up again? Because part of what I want to see are threads, right? So to understand how prevalent and pervasive grief and trauma have been, and then kind of connect that to what they're considering to be a turning point or pivotal moment where they can readily identify their grief. What often happens when I work with clients is that they're coming in because of one specific death. But as we do this chronological exercise, they're realizing that what's showing up right now is really an accumulation of many things that happened previously. And that really can help us start the discussion about what to focus on in the present.
That brings me to another question. I'm going to start with you, Dee, and also Dr. Harris. If you want to jump in too, feel free. Do you feel that there are times where your client or patient may be trying to repress or mask the signs of trauma or grief? Or maybe they're in denial. Like, I'm fine. And I just want to be here to go through the motions, so to speak, and not necessarily open to the idea that they have experienced a traumatic effect of any kind, right? And it all could be based on perspective of what is traumatic from one person versus another, because that might be different, right? So have you experienced, we'll start with you, Dee, a person who has tried to mask or is in denial of experiencing trauma?
Oh, very much. I think it's very common because by the time they typically reach me, they're way past when they should have shown up, but they don't know it because most people who have experienced trauma oftentimes are in survival mode. And so they're doing the best that they can given the set of resources and tools that they possess. And when they've run out, that's when they usually come for help because now they've depleted or gone through everything that they know. And then they show up. As far as repression, I think that, again, that's a subjective thing. I think that when with trauma, suppression, and it's just a natural thing because our bodies do that to keep us safe as they're able to tolerate memories, then I always tell them that we'll unpack them at that time. We don't need to go digging into your past because typically trauma is multi-layered, which is why I said I typically work with complex trauma. A lot of my patients are people that have had ongoing lifelong events, mainly adolescents. I worked in the juvenile justice system and I always saw them as just byproducts of the world that they came from. So there's a lot of hope in me for youth because they only know what they know. And oftentimes they haven't really been given the opportunity to be treated that they're capable and worthy and lovable, and that there are people out there who really do want to see them succeed and be healthy. So, with repressed memories, again, I think it's just a safety mechanism. But when they feel comfortable and able to trust the people that they're working with, then I think naturally the guard will come down. And often, unbeknownst to them, they don't even realize what they're repressing. I see a lot of times with my patients that as they work through, like Dr. Harris said, they'll come in for one main thing. And then as we start unwrapping it, more stuff starts showing up. And then that's how we gently start creating a new narrative and exploring. And I love the chronological exercise because I love doing that with people that, especially older patients that feel stuck because they can't get past certain points in time. And so we use that to help loosen it up a little bit. But I never probe for something unless I feel like they're able to tolerate it or if they're ready.
That's a really good approach because then that can potentially cause that person to pull back and not want to share. And it could set them back with that healing process too, I would imagine.
Or create another trauma.
Exactly. Yeah. Oh my goodness.
Yeah.
Good
For the
point.
yeah,
Yeah,
like when we push too hard, we we create a rift in their trust. So it makes it harder for them to go back. And I think that's really important. And especially for providers to be willing to humble themselves if they feel like they've made a mistake to repair a rupture so that the patient understands that I'm sorry, I may have pushed too hard, or I'm sorry, maybe I went into an area that you weren't ready for. And then we need to know when to pull back so that they feel safe with us so that they can continue their healing. But because the last thing we want to do is create an environment that shuts them down.
absolutely. Do you have anything to add to that, Dr. Harris?
Yeah, I loved you that you talked about safety. So I think that uh, there are, if we think about people on a spectrum, right? There are those folks like I was who, when I began my grief journey, that I made a conscious effort. I didn't want to be part of that club. Even though I was a psychologist at the time, it sounds a little bit ridiculous. I thought, well, that's not going to be me. I will not succumb to grief. So that can happen. But I think what happens more in large part is that people are trying to protect themselves, right? Our bodies, our spirits are designed in such a way where safety is paramount. And it's not so much that we're denying or actively repressing things so much as it is we want to create a safe environment. And sometimes, as Dee said, touching and looking at these different areas, shining a light on our loss is very painful and disruptive in many different ways. And so, rather than doing that, this is happening unconsciously, we dance around that. But again, as Dee mentioned, it's important that as a therapist, you are helping provide that safe environment so the person can operate in the safe place and be more forthcoming. So I think that was a really important point.
So far from what I'm learning, I love the approach. And I just want to contrast that with something else I've been learning. I'm studying Ayurveda, integrative medicine, and I'm in my third year. And we talk about mental health and mental health aspects being the root cause of most illnesses, how things manifest, right? It starts with the mind. And then if that is out of balance, then we don't make the right choices for ourselves and, eat the wrong foods. And then it goes on from there, right? But the one area that we talk about is the balance with addressing the root cause of that mental health, the trauma or the grief, but also not getting into the space of ruminating. Because if one gets into that space, they can get stuck, right? And this is a question that I hadn't prepared, but I'm curious about is when there are group settings, right? It's nice for community and group settings where people understand where you are and you're going through that healing trauma, that traumatic event. Other people may have a different type of traumatic event, but at least you have that support that everyone that you're in the room with knows how that feels. But then do you feel there can be where it might not be beneficial, where there could be ruminating happening, where they keep reliving that over and over again with the discussions if they're in a community-based approach?
Oh, I've got to jump in here and answer this. I was waiting to unmute myself because this is something I talk a lot about with my clients. I think there is this really delicate and thin line between sharing one story in an effort to continue to transform and grow alongside it and ruminating in the story. I think we've got to be really careful. The question that I often ask folks is, as you are sharing your story, and I ask myself this, as you're sharing your story, what is the motivation? So I think sometimes if we're talking about ruminating or sort of getting caught up in the story and the, for lack of a better word, the thrill, right, of whatever that story or narrative is, we can be doing it because we feel unseen. And being able to share the narrative provides a space, sometimes in a group setting, sometimes with an individual, where you can feel seen, right? On the other hand, are you sharing from a place of wanting to educate or wanting to inspire or empower? And so I think we've got to always assess that, and that will sort of help the person understand where they're falling on that spectrum. So when I'm working with clients and we have shared that story, we've shared that story and we've shared it, and I'm sort of uh, providing that question to them. If I notice that now they've sort of shifted from a place of rumination, if you will, to more motivation, then we start talking about the benefits of therapy and whether or not they really need that additional support, as opposed to someone who may be in the narrative needing to share it so that they can feel validated within themselves and or to receive validation from other people. So, but it is a tricky dance sometimes. Yeah.
Yeah. Yeah, absolutely. There's a lot of gray areas, and I've often thought about this because people say, tell your truth, share your story. But that is so profound. What is your motivation? And so you're shifting rumination to motivation. And really, rumination would fall under the victim mentality. Motivation is empowerment. I think the key for people today, because there's a lot of people struggling with so much going on in the world, right? How do you shift that? What are the steps? And the steps for one person may be very different from the next. And I think that sharing a story is therapeutic in itself, getting that energy out of the body, but it doesn't necessarily need to be public. It could be a journal. It could be, a friend that they talk to, a therapist. So some other ways of getting that out. That Thank you. A lot of light bulbs went off as you
I,
mentioned that.
I think to your point about the group setting, again, we have to sort of provide a cautionary tale to clients in that group environments have benefit and there are also costs associated with that potentially, where you are hearing many different traumatic aspects of another person's story. And if you're not really mindful of your motivation and the space with which you're sharing, then it becomes more of a venting fest, right? Where there's really not anything therapeutically happening. And so we have to always be mindful of where we are and whether that space is going to offer a chance for transformation and personal agency or possibility of remaining in a ruminated state.
Excellent. So basically understanding the goal, like what are your intentions and what's the goal? And as a therapist, you're helping them walk through that because they may not be in the state of readiness to identify that. And so you can see that so clearly and help them redirect. That's excellent. Dee, do you have anything? Have you experienced this with that, or do you want to add to that in any way?
I really do agree with Dr. Harris on this one because I think that I've done a lot of group work, especially with within the legal system. And so working with probationers and parolees, that we tend to call those war stories where they regurgitate over and over again. And it almost sometimes can be glorifying some of the things that have happened. And I find that I don't know that they do it intentionally, but sometimes it keeps them in a victim space. And sometimes, like when we talk about grief, sometimes trying to get them to break away from that place creates like a grieving space because it's part of their identity. And so helping them to establish a new sense of self can be really a tricky thing. But if it works, it can be so empowering and so liberating for them to realize that they can break free from an old cycle and create something new moving forward. Not to say that we don't want to, we never want to invalidate what they've experienced or what they're going through, but we also have to be really careful um, to not allow them to stay stuck, I guess, if that's the right way to say it, but and not allow, but encourage them that it's okay to feel sadness and pain and loss, but it's also okay to experience joy and happiness and hope and optimism for the future.
So you said something that stuck out. They use that as part of their identity. So that's a form of attachment, right? Like that is me. This story, it defines me. That is who I am. And so part of that healing process is opening up the consciousness of that person. And there
Yeah.
are various different ways of doing that. I know I'm just like giving a little teaser as to what's to come in this discussion. I just thought I would
Well,
can mention that.
Kristen, can
Yeah.
I share? Can I share something? I love that the word identity was used.
Yeah.
Uh, One of the exercises that I really love with people is crafting a mosaic. So each of us is a mosaic. And when you look at a mosaic, there are many different pieces that come together to form our whole, right? Our whole being. Grief being part of that, trauma being part of that, but that's not the whole mosaic. And so one of the things that can be helpful is to help people realize, and even in from a tangible perspective, maybe we draw out a mosaic and think about all these different pieces that have come together to make us appreciate who we are, grief and trauma being part of that. And sometimes, as I've done this with clients, they may be sitting there thinking, I can't think of anything else beyond this experience in my life. So it's a great challenge as a therapist to help them shine a light on other pieces of their world. And it's really beautiful to hear when people can see that, yes, in addition to my grief, there is another part of who I am so that we can reshift that mosaic post loss or post trauma. So there are some practical ways to help a person really better understand their identity.
And you also said who I am. And that is, again, the identity, right? Who am I? And when the mosaic is it seems like would be a great practical application for a person to tangibly understand what the message you're trying to give to them. Because when we talk about wholeness or consciousness, it goes over many folks' head because it's not necessarily an obvious, tangible application, right? That comes in time. That's more of the spiritual approach. But with identifying or attachment, that's more of a dualistic or polarizing application. And we are a reflection of our outer world, meaning the leaders in the world, the folks that we come in contact with, vice versa. And so if we are in a dualistic state where we're detached and we're attached to an object, we're actually showing the experience that we're seeing in the world of what's going on around us. And also that is mirroring where we are. So I know I'm going off on a tangent, but I'm setting the tone for later as you start talking about some of the therapies that are possible and walking through that. So that beautifully, eloquently stated, both of you. I really appreciate this. This is really cool. D. So that kind of leads us into the next area of based on your experience, and you talked a little bit about this, but maybe we can expand, is how do trauma and PTSD manifest in patients dealing with physical health issues. And how do you address both aspects in your treatment? So we know that we've got daily stress, right? That can be a form of trauma in itself at a lower level, depending on what the stress is. And then we have traumatic events, but then post-traumatic stress. So, I don't know if you want to differentiate, if there is a differentiation on what those are first. And then if you'd like, I can re-ask the question also.
Yes, maybe re-ask.
Okay.
Yes,
So
yeah.
first kind of explain what stress is, post-traumatic stress syndrome, and trauma, if there's a difference, or how one might lead into the other. And then the actual question is based on your experience with how trauma and PTSD manifest in a person, right? In patients dealing with physical health issues, how do you address both aspects in your treatment approach?
Okay. So I think like normal everyday stress, we're all familiar with. It can be tightness, headaches, tense muscles, various somatic physiological symptoms that we experience. And PTSD and trauma can also, well, more often, they do exhibit the same kind of symptoms, but more intensified and for longer durations. As far as like physical symptoms in terms of like maybe medical issues, yes, there are a lot of things that show up for people. Interestingly enough, there are some clients that I've worked with that have ended up in the hospital due to unexplainable symptoms or ailments that the medical world can't find any salient or a clear indication of what's going on, but it keeps showing up over and over again. And there we would call those psychosomatic symptoms because it's something that's there, but we may not know exactly where it's coming from. I find that with clients, PTSD, if it's like an isolated incident or like a short or duration of time, oftentimes we think of like combat veterans. And sometimes they may have had like what we could see as like a typical or normal, quote unquote, life up until joining the military, and then maybe a span of time where it was extreme exposure to wartime events. Whereas, like maybe complex trauma is a little bit different in the sense that it could have been from birth forward and not necessarily noticing or recognizing that these events were traumatic until usually later on in life when there's like a comparison as to like going over to a friend's house or experiencing a different family's lifestyle or whatever. And then there's this stark comparison to what your home looks like versus theirs. And then that can be actually trauma inducing. Prior to that's just their life. And they may feel some physical symptoms, but not really be able to identify it as is something like an ailment, so to speak. So a lot of the work that I do incorporates a lot of mind body work. So, like you had said earlier, it starts in our mind, and I would agree with that. And then it manifests in our body. And so, when we can work with the two of those, we can often bring some relief to people. Yeah. I don't know if I answered it fully, but
Yeah. Oh, I was going to follow up. What type of mind body work? Do you have examples?
so I do a lot of mindfulness and meditative, so breath work, a lot of progressive relaxation. I really try to get them into their body as much as possible, grounding techniques. And I encourage them to practice it like a fire drill and like practice it all day, every day, just so that if something were to come up, you're equipped and you're ready to handle it. The reason why I think initially they don't understand it, but I'm like, the more they do the work, the more they notice the little signals their body is sending them. And the more they notice those things and they compare it. A story that I tell a lot of people is earlier on and when I was interning, I had shown up one day and I had bruises all over my chest. And I was like, I was really scared. I'm like, I don't know what's going on. They were these purple marks all over. And a colleague of mine and we were sitting there talking one day and we were just discussing something that was like really stressful in my life. And all of a sudden I started pushing on my chest. And she goes, there it is. And I said, there what is? And she goes, there's the bruises. And not even consciously realizing it, whatever I was feeling internally was creating this distress within me. And so I was alleviating it by pushing on my chest. And that's what I share with my patients. It's like sometimes it's autonomic and we're not even paying attention to it. And we don't even
Yeah.
recognize that we're doing something or experiencing something. So the more we integrate back into our body, the more we can recognize those little nuanced events or signals that our body is sending us.
Yeah, and I actually do transcendental meditation. I tried other types of meditative techniques, but that was really helpful to me because I easily distracted. I would get frustrated, like, "Gosh, I'm supposed to be paying attention and meditating," and that's actually the opposite of what you're supposed to be doing. You're supposed to not be paying attention. So that's what helped me. Now, is there any type of meditative technique or breath work technique that you recommend?
I really encourage them to find something that speaks to them. There are different apps. They could go on YouTube. There's one called Insight Timer that I typically recommend to a lot of patients because there are a lot of free resources on there. And one of the things that I explain that I think is the most important thing for them is to listen to the voice, because if the voice is soothing and calming to your system, you're more apt to follow through and actually finish the exercise. Once they experience maybe guided meditation or progressive relaxation with a voice that can be calming and soothing to them, and they learn the skills, then they can start doing it on their own.
So the goal is to go into a transcendental state, and that is actually where the healing takes place. And when the mind and body start to balance, and we know our physiology actually mirrors our consciousness level, and our consciousness level increases when you're able to reconnect mind and body and create that wholeness. Have you found that sound therapy has helped with that to create that effect? A person being able to go into a meditative state, like with alchemy bowls, for example?
I've never used those, but I will use like meditation music in certain situations. I know at home we listen to it a lot. It's very calming and soothing in my house. It's interesting when my kids are stressed, they'll want to listen to it. Like, Mom, put your music on. You know? And so I think that there is something to it. But again, I really encourage people to find what speaks to them, because if it speaks to them, then it'll likely work. Uh, and so I don't wanna try and force one thing or impose something on them that maybe wouldn't be something they would typically use. So I really encourage them. I give them like a roadmap and then let them go and explore.
That's wonderful. You definitely don't want people to feel that they can only choose a few things because that creates resistance in a person being open. Going back to the apps and the music, it, those work. And there's actually just anybody out there that wants to know on, I think it's Pandora has a channel, and I'm not advocating for Pandora. It's like there's a bunch of other channels that have soothing music for your dog. And it has some of the alchemy bowls. I play that, and my dog will hop on my bed and go to sleep every time. So I told the local vet about this, and he was pretty intrigued by that. So anyway, just putting that out there. If it works for the dog, a golden retriever, it probably works for humans. So thank you very much for unpacking all of that. Uh, Dr. Harris, do you have anything that you want to add to this as far as with grief and a patient is or client is dealing with physical health issues? How do you address those? The underlying aspects or obvious signs that might come to you.
Usually, when a person comes into my office, they have not made the connection between physical health symptoms and grief. So I often hear, well, I don't know why I can't sleep, or I just have aches and pains in my body that came out of nowhere. And so, one of the foundational places that I start is with a lot of education. And you mentioned the word balance. I think that it's important that people understand that our bodies, minds, and spirits are designed for balance, what we call homeostasis. And when a sudden event happens, whether that be a traumatic event or the death of a loved one or loss of something that we weren't anticipating, and it overwhelms our system, we then experience an out of balance state. It's providing a lot of education to know that in the normal, typical, non-chronic situation, our body can handle stress by alerting one part of our nervous system to respond to that. And in a healthy situation, right, one that's chronic, we can experience some resolve over time, right? And we've all experienced that on the day to day. However, with trauma and grief, these are lifelong journeys. And so people don't tend to resolve right away, or if they do resolve, yeah, here comes another experience with something that's triggering to them in their trauma journey or their grief journey. And so the body has a hard time sort of getting back to that place of balance. And so I think a lot of education about the nervous system is so important so that they don't beat themselves up for these physical health symptoms that they didn't realize were attached to grief. I'll share a personal story. When my mom died, this is related to how she died and where I was. I experienced a lot of trauma around my bed. And it was very difficult for me to go to sleep because when I entered that space, my mind took me to my mom, that environment, her physical death. And it was very difficult. I felt aroused in the bed. And over the course of a couple of years, I had to do a lot of sleep retraining and a lot of the things that Dee mentioned in terms of relaxing my mind, listening to sounds, all of these different things to create safety in that space. And even now, right, my body will remember, right? There's a wonderful text written by Dr. Bessel van der Kolk called The Body Keeps the Score. And I think it's such a critical read for folks to understand because as you recall that, it makes sense that your body, even though your mind knows that you're elsewhere, your body will take you back or has the potential to take you back to that moment, which can re-arouse your entire nervous system. So education, and then, as Dee mentioned, a host of interventions based upon the client preference that are going to help them reset or re regulate their nervous system.
So, as far as therapeutic techniques or strategies that are most effective in dealing with grief, are there others other than the educational component or the intervention and the steps involved with that?
Yeah, I
There's
think Yeah, I think there are so many evidence-based interventions. Now, I will say I'm saying so many within the grief space within the past 15, 20 years. This is relatively new research. So I'm still calling this burgeoning. Number one, because grief, just like trauma, is so individualized that it's not a one size fits all. And we're understanding the ways that grief may manifest that's not just linked to physical death. So, in terms of some evidence based or emerging practices, using cognitive behavioral therapy, which is essentially helping understand that relationship between one's thoughts or mind, what they do, so the behavior and their thoughts around that, or thoughts, emotions, and behaviors. And so helping to really unravel that, because as I think as Dee mentioned, as a person thinketh, right? So is he, right? If a person's thinking, oh my God, I don't want to think about that. And they are going to respond emotionally and maybe an avoidant state. And then behavior wise, they may be actually exacerbating symptoms by not leaning to the trauma and or grief. So that becomes really important. One of the things in the grief space is really identifying what's called loss adaptation. So grief doesn't go away, right? As much as we want it to go away, it doesn't shrink over time. Really, it remains the same size. And so, what the goal is to develop strategies to adapt alongside it. And so I use a lot of therapeutic techniques and rituals to help a person recall that grief is with them all the time. However, how can they move with it? Very similar to a leaf flowing down a river, right? That river's there, that leaf is there, and that's free. And as a river, you're sort of flowing along with it. So the goal is not eradicating grief, forgetting about the trauma. It's how can I sort of work in tandem over time. So that really becomes part of me adapting and establishing life and meaning with it versus eliminating.
so as I'm listening to this, like a couple of light bulbs are popping or going off. You said a couple of things: loss adaptation And so our thoughts are so powerful, and visualization of where we think we are is what we create in our reality. And so you also talked about through the use of rituals, which would be like a consistent daily routine because where bodies are trying to go back to homeostasis, right? In starting with the mind and the physiology follows. So if we have a consistent daily routine, that might be one way, I think what you're saying with the rituals to get that person into, oh, I got up this morning at 5. Yay, check the box. Next thing, I made my bed. Another accomplishment. Awesome. Next, I was able to take a daily walk, or I did yoga or whatever it is, right? I went to work. I went to school. I finished my homework assignment. So all of these things kind of create that consistency with the routine, but also a feeling of accomplishment that they were able to. Now I'm going to go into the other part, integrate. So you're
Yeah.
talking about instead of avoiding or trying to say, this is gone now, right? It's poof, cured, whatever word you want to use. Now you're taking that challenge, which is the trauma, the stress, the grief, which could be considered kind of our shadow side of ourselves, and we're integrating it within our own entity. It's like we're taking that and we're shifting that energy into more of a positive way instead of ignoring it. It's a lesson, it's a challenge, however you want to label it or look at it, for us to learn from, integrate, and overcome. And I guess you take on some super human powers at some point. Am I getting ahead of myself here with this conversation?
Well, no, I think all of these are interrelated. I think that with regard to the first point about routine, it's
Hmm.
absolutely critical. I say this probably at every encounter I have with my clients on the podcast, which is no one wakes up on a given day and says, this is the day that my life is going to completely shift in a different direction that I didn't anticipate, whether that's a loss of some sort or a traumatic event. And so being able to establish predictable routines is everything in the face of very unpredictable circumstances. And with trauma and grief, there are so many things that will provoke our thoughts about it, which keeps us ebbing and flowing day to day. That to know that we have what I like to call anchors throughout the day, whether it's I'm going to wake up at this time, I'm going to eat at this time, I'm going to call that person that is supportive of me at this time, create those anchors. So at least we're putting down some roots so that we don't feel completely discombobulated, which only dysregulates the nervous system. I also love to encourage folks, and this is going to sound very counterintuitive, to schedule grief. Right? I write a
Mm.
prescription for grief. Right? It's okay because grief is not going anywhere. To remember that you can schedule it in. So number one, that sends the message, this is not something you get over. One of the reasons I will never use the phrase grief recovery, because you are not recovering from it. You're learning to adapt alongside it. So scheduling time to grieve reminds them of that. It also reminds them that, yes, I need to lean into it. I can't spend my whole day overworking to avoid this pain. I schedule time. So even for myself, 2 times a week at the same time on the same days, I schedule 30 minutes. And it's one of those things that it's not going to change regardless of what's happening in my schedule. And it's 30 minutes to just sit with things. Sometimes I'll cry. Sometimes I will laugh at memory. Sometimes I'll do a grief ritual. Sometimes I will just sit. But the purpose of it is to remind me that grief is there and I deserve to honor the fact that I'm listening to my body, mind, and spirit during that time frame.
And it gives you the opportunity to release that energy out of the physical body, which,
Absolutely. Very much what Dee was saying about somatic practices.
yeah,
Absolutely. This might be a place to do some movement.
I'm going to shift over to you, Dee, with the next question. But before we do that, can you explain to the audience what somatic means? Because some folks may not understand what that means.
Yeah. So a somatic symptom is any kind of like manifestation of like maybe an uncomfortable feeling within our system. So like I said earlier, it could be a headache, it could be a stomach ache, It could be aches and pains. It varies. Some people that I've worked with have presented with like abdominal migraine. And I think that what happens, like Dr. Harris was saying, is sometimes we try and avoid the uncomfortable feelings. And so we're trying to distract ourselves. And like to tell my patients, it's like an old fashioned just married car where they tie all of the tin cans to the bumper. I'm like, that's like your grief and your trauma. And like you're running away from it or driving away and it's just tinkling around behind you. And I'm like, so sometimes it is better to sit with it, as Dr. Harris said, because I think that when we give space and validate the things that have happened in our lives and normalize it for ourselves, I think that's where it's most important is that we can normalize it for ourselves and give space to the grief and the healing. It helps to lessen the enormity of the impact on your system. And it's like a book. It's never going to go away and it can stay here, but it's not prominent and it's not taking up like an enormous amount of space. But because a lot of times we don't want to let go. Those are our memories and those are our people. And I would never encourage somebody to try and diminish or do away with the things that have either caused them trauma or grief, because again, this is their story. So we want to help them to unpack it in a way that is meaningful for them, which is a lot of like narrative therapy too, is like we can go through and explore the events and the salient things that have happened in somebody's life, and there's a narrative around that, and sometimes we can help them shift that narrative a little bit so it's less traumatizing to their system and a little bit more powerful.
I have an analogy I wanted to run by you, and I'm curious about your feedback. I don't know if it's appropriate for this context, but I've used it with like, where do we put our attention and how much do we put our attention and how it manifests, right? So it's one thing to be aware of something. It's another thing to put the huge focus on something which can create a lot of fear, right? And we know that fear is really the root of all of what we're talking about here. Kind of goes to that saying with Franklin D. Roosevelt, the only thing to fear is fear itself. Because out of that can come a lot of other instabilities, right? Within the human body. So here's the analogy. Have you, either one of you, ever snowboarded or skied? Okay. All right. When you ski or snowboard, do you look at the tree?
To be honest, in the very beginning, I was literally looking at my feet with fear that I was going to hit the tree. And first,
Yeah. Yeah.
once I became a little bit more skilled, then I was looking in the distance. And so this reminds me of the windshield rear view mirror sort of focal point, in that if you're
Yeah.
looking solely at your feet, in your example, the likelihood of crashing is greater
Yeah.
as opposed to looking more in the distance.
Mm.
And I think for grief, this is a beautiful analogy to when you drive, when you see, you've got to make sure those feet are okay. And you've also got to look out in the distance. So it's not a matter of either or, it's
Right.
both, right? Same thing.
Yeah.
You've got to look ahead. Every now and then you got to look in that rearview mirror. I think with grief, it's developing that dance between looking ahead, yet not forgetting, right? As Dee said,
Right.
we're not trying to completely forget about these things. Yet, if we only look in the rearview mirror, we're also going to crash. So we've got to be able to do both at the same time. I love that.
So basically, if you look at the tree, you will absolutely hit that tree. But you don't want to ignore the tree altogether because you could potentially hit the tree. So the goal is to be aware the tree is there, kind of glance over and go, I see you. But like you said, you want the direction you look is the direction you're going.
Yes.
So if you hyper focus on the tree, you're going to bring that in. If you ignore it, you could bring it in.
Yeah.
But if you're like, you're there, it's kind of like with the grief or the trauma, like I'm aware of it. I am aware of the triggers, but this is the direction I want to go. This is where I'm going to bring myself through those trees without hitting them.
I love that. This narrows my love language because I think it's metaphors.
Yeah.
And so something else just popped in my mind, and that was shadow, right? So
Yeah.
another way to think of this, like trauma will companion you, right? Grief will companion you over a period of time in your life. Yet, depending on where you stand, if you're outside, you can see the shadow more visibly depending on where you are. Yeah, sometimes you're standing there and you don't see your shadow because it's cast behind you, but it's always there. And so, again, not denying the fact that it's there, but what's the focal point? Very similar to our conversation about identity. How can we pivot in our experience with this as we adapt to recognize that it's there, but it's not all consumed to our lifestyle?
Do you want to add to any of that?
No, I
Putting
agree.
metaphors in.
That's it. Is like we have these different analogies, and I like to just look at the kind of person that I'm working with. And sadly, because I've worked with so many people associated with the criminal justice system, I use an analogy where it's like, yeah, I tell them your mind is like a scope on a gun. Wherever you point it is where it ends up. So if you think that you're stuck and you can't move past this, you're absolutely right. If you think that there's hope and possibility, you're also correct. And so trying to encourage them to venture out. Sometimes what I think a lot of people don't understand is grief and trauma is what they know right now. But what's beyond that can be really scary. So we can attach to comfortable and familiar, not realizing that we also can stifle ourselves out of fear. And I think we had mentioned fear earlier. And so I always remind them that there is that autonomy that they have and they get to choose where they want to go in life. And if this is what feels safe and comfortable for them now, that's fine. But also don't be afraid to venture out. And that's where I use like a lot of incremental exposure with people, and I try and get them to understand that it's okay to just try new things in small doses. Um, I used an analogy yesterday where I was like, if you could imagine these experiences, I want you to start off with little grains of sand. And as you feel comfortable with the grains of sand, then we can move on to like pea gravel and slowly grow and build up our tolerance. But it's okay for us to start very, very small and tiny, so that we don't overwhelm our systems.
Great point. I'm really enjoying this discussion. This is so cool. And I think the use of analogies helps people understand it's like an interpretation connection, right? Like, here's what I'm talking about, the blah blah peanuts gang stuff, but here's tangibly how you can connect it to you. And I am a visual person too, so I tend to try to use those to help people understand what I'm saying. So I think I'm going to ask this next question for both of you. Are either one of you familiar with studies or research to explore the connection between trauma, PTSD, grief, and how it can manifest into specific illnesses such as neurological issues, immunological disorders, cancer, for example? And we'll start with you, Dee.
Yeah. So earlier on in my education and my internship, one of the salient research articles that kept coming over and over again was that ACEs study, which was performed by Kaiser Permanente. And I think that it definitely draws a correlation with health issues. But as like you and I have talked about, Kristen, is sometimes I think what's not really emphasized is that I'm wondering what it would look like if we were on a broader scale, a bigger sampling of people outside of the medical realm, and to see how many people are out there that have also experienced adverse experiences but maybe don't have these manifestations. And I wonder what
Mm,
brings the difference between health and resiliency versus sickness and disease. And there is correlation, but there's also the other studies that I look at also show that they call them counter ACEs. And so sometimes it could be a supportive person or engagement in something meaningful in somebody's life that can counter those adverse experiences and actually cultivate health and healing. So I think it's really careful that we use those studies lightly. I know that they can be informative and impactful as far as research is concerned, but I find with patients that I try to not utilize stuff like that because I don't want them to see that as a doom and gloom. Like, oh
Mhm.
no, with the ACEs study, I remember in grad school, we were all given the opportunity to take it. And I would have to say the majority of our cohort experienced probably all of them or the majority. It was very, I think only one or two people experienced like one adverse childhood experience. The rest of the cohort experienced almost all of them. And it was interesting to see how that impacted people in that moment because there was almost like this association of, oh no, I'm doomed. Versus some people were like, "Oh, that's nothing. I'm fine. I don't have any." So it really is a personal perspective. So I try to stay away from that because I don't want to give somebody a negative association. But I am more I'm probably lean towards positive psychology, where it's I don't want to be a Pollyanna, but I want to really infuse as much hope as possible and encourage health and healing because I think like what we were saying, like when we integrate there's so much more potential for healing. Um, yeah. So I think the mind body model tends to be a little bit more where I lean versus necessarily like the medical medication model.
Well, so I want to make sure that we're on the same page with this. So the question was, are there studies that show how the trauma and any of these things can lead to any of these diseases? And I think what you might be saying is you're careful on showing those studies because you're worried that someone is going to say, "Oh, because I had this adverse childhood experience in my past, that means I'm going to get cancer," for example, or a neurological disease or an immunological disease. But it also could be flipped around where um, there is a connection. For example, there's a connection here, but here are the steps that you can take to A, prevent, B, to shift things back, right? Because I think that's where the integration of Western medicine, Eastern medicine, holistic care, psychotherapy, all of these things, it's a perfect opportunity for them to learn from each other and to perform those studies. But not only that, but devise a model on how to prevent instead of treating symptomology or, the after the fact, is figuring out a way like twofold to prevent and to treat the person, not treat the disease, which is different because the person has the mental aspects to consider, the digestive aspects, the central nervous system, and then looking at all of the systems and how they work together. So it's a holistic approach versus parsing it out, which is similar to the dualistic thing that I was talking about earlier, is that wholeness. So, do you think that, let's say there were studies that talk about here's where this can lead, right? However, here are things that people can do to reverse some of this or prevent. Would that be something that would be helpful for you to have a conversation, or would you more want to collaborate maybe with an integrative medicine doctor or something like that?
I'll take that one.
Okay.
Um,
Awesome.
yeah, I totally understand what he's saying, and that you don't want to be prescriptive and you don't want to set the course of outcome out for someone so that you're adding perhaps to the stress that they're experiencing. At the same time, it certainly can be an educative piece. The National Institutes of Health has absolutely, with regard to grief and trauma, connected those things with weakened immune systems, stomach upset, fatigue, sleep dysregulation. And one of the interesting things, I think, for both trauma and grief is that depending on the source of the trauma, of course, is that a lot of this has to do with a rupture in social connection. So obviously, with the grief, the death of a loved one, that social connection is no longer there. And even with trauma, the trauma may be connected to an individual. And so when that social connection is gone, and we are so pre-wired, as we know, for social connection and so forth, that loss of social connection can then basically cause a bit of, or contribute to a chain reaction in the body where the person doesn't feel protected anymore. definitely think that there's space for both and that we've got to educate and also be mindful of the person in front of us to not want to overwhelm them. So much information that now they're thinking, oh, great, this is going to be my outcome, right? Or this is what I'm necessarily experience. But there's room for both for sure.
I like that. And I think that goes to neurolinguistic programming, right? Which I've read a couple of books where for example, there was a doctor, and I can give you this resource later.
Okay.
There was a doctor who is a regular practicing Western medicine doctor, went through the process and decided, like, this isn't for me. With the way that he saw some of the physicians where he worked, this doesn't mean that all physicians do this, right? But the physician there said, you have cancer, you have 4 weeks to live. So now the person's mind goes to, that's my outcome. That's my identity. That's where I'm going. And there was this actual study that looked at that approach, and a high percentage of those folks actually perished as a result of that because their mind believed that.
Mhm.
So in his practice, shifted that instead of saying this is an absolute, right? He said, you've got this thing, and I'm paraphrasing, and it's going to be a little challenging, but we're going to work through this together. We're going to look at all of the opportunities for you to shift out of this.
Mhm.
And it creates hope, it creates faith, and there's always room for miracles. There is no limitation there. There was an openness to allow whatever needed to come in to carry this through, whatever that was supposed to be. And so it was just the way that this doctor handled all of this was just incredible. So neurolinguistic programming can be used either way, right? Can be used in a way where we might consider not beneficial, but it also can be used in a very beneficial way. And that goes to words are so powerful because it creates our realities. So I can totally see uh, your points with, if we read this study and it might be overwhelming for someone who's still in that very tender state, then they might not even be open to hearing anything like that right now. It could be dependent on the person. It could be depending on the situation. It also can be dependent on where they are in the process of healing and where they might. You're both the experts, and you would be able to feel out when it would be the appropriate time to bring up that information. And also, maybe you don't even bring it up, but with your knowledge, it helps you kind of guide like the flow, right? Do I have that
Oh,
right?
yes. Now I'll
Okay.
add to this. It
Okay.
sort of reminds me of that juncture in a person's journey where they're able to tolerate and. So
Mm.
as I sit with people who are grieving, sometimes they're not there yet. When I'm talking about being able to simultaneously hold up grief and hope, they're like, what the heck is she talking about? Is she crazy? That's never going to happen, right? My entire worldview and way of being is totally focused on the pain. And it is important to recognize when it's tolerable in the therapeutic process to start introducing. I'm a huge seed planter. Not only do I think in analogies, but I love farming. Thinking of our roles as therapists as seed planters, right? We may drop a seed and we may not stay there and water it that day, that month, that quarter, because the person can't tolerate that from a psychophysiological perspective. However, we may go in and put drops of water and eventually water that so that they can shift from pain only to, yes, I've experienced trauma and, right? Yes, I'm grieving and. So then it becomes that both and conversation, which helps propel them towards a space of hope that they may not have been previously ready for. So I think it's just critical to gauge where people are.
Thank you. So the next question I wanted to shift to is, have either one of you ever collaborated with another provider from another field? Maybe it's a holistic provider, maybe someone in the Western medicine area, for example. And If you have, which type of provider, and can you provide an example? And I'm going to start with you, Dee.
Yeah, absolutely. Aside from like referrals, collaborating, I work with psychiatrists in the field. And a lot of what I want to understand is if I were to refer, how would they treat the specific client? And then I gather information so that I can go back to my client and discuss what their options are. So I like to collaborate with different areas, especially like in our local area. We have a couple of psychiatrists that are doing really new and innovative work. And so I want to understand what they're providing or what options they can give to patients. And then again, empower patients to make the best decision for them. I think that creating that autonomy and that sense of agency, like you had mentioned earlier, Dr. Harris, is really important because the more that they understand that they are the ones who are driving the vehicle of their healing process, the better equipped they're going to be able to make decisions moving forward. I always tell my patients it's their job to work me out of a job because I want them to feel like they don't need me anymore. And so when we collaborate with other professionals in the field, it's really doing that wraparound as well and gathering as much useful information so that we can share it with our patients and allow them to make the best decision for themselves.
Dr. Harris?
Yes, everything Dee said. I think as a therapist, collaboration and referral are just naturally embedded in the work that we do. Even as a private practice practitioner, sometimes it can feel a little siloed that multiple times a week I'm on the phone with a medical doctor to discuss if I have a client who may be experiencing more acute psychiatric symptoms. Perhaps there's space for medication. The other day, I was speaking to someone who specializes in Reiki because my client was interested in learning more about that, the energetics of that as it pertained to her body. And so I was on the phone with that person, of course, with the client's consent to talk about what came of that session and how I might be able to integrate those components of the care. And then I love collaborating with folks like Dee, other therapists, psychologists, because we together are powerhouses to be able to think of things differently and to even come up with practical strategies and ways of thinking with clients that perhaps I haven't thought of. That's just something that I naturally do in the day to day work, and it's super powerful. In the rare situation, and there are situations where a clinical presentation is perhaps very nuanced, very layered, very complex, and or chronic, I may refer out to someone who has more expertise, specialty, if I feel like the person needs more support or intensive care, or if there really is a critical incident. For example, if someone is not only having suicidal thoughts perhaps, but is planning to harm themselves and have a plan to do that, or the means to do that, then of course, maybe I'll definitely be offering some additional supportive services for that person. But this is absolutely embedded in the day to day work that we do. I get very scared when I talk with other providers, like, oh, I never collaborate. And I'm thinking, then I will never collaborate with you.
Yeah.
It's important. We don't know everything. And it's important that we have multiple perspectives in our ears.
This
I
is
would,
awesome.
yeah,
Oh, go
and I
ahead.
would echo that. I think that as a provider, if you run across somebody that is that closed off to hearing from other people, that's a dangerous provider. In my opinion, I want to make sure that if I'm stuck or if I have a question, that my ego isn't so powerful that I can't reach out and ask for help. We're taught in school to be lifelong learners. And I think that's really important that we continue because I think that it also models that to our patients too, when we can say, oh, you know what? I went ahead and I talked to other people, and this is what we're all on the same page, and we think this would be a great approach. What are your thoughts? And again, involving the patient throughout the process, it also shows them that it's absolutely hey to reach out to other people for help because there's a power differential, not intentionally, that we're in because they perceive us as the experts. And so when we can normalize that for ourselves as professionals, then it encourages them and models that behavior for them so that they also feel empowered to reach out for help within their community as well.
This reminds me of another strategy that I like to use with clients, and that is it's called Wisdom Chronicles, where over the course of therapy, I might have a person perhaps in their journal write down the wisdom that they gained through an experience, wherever they are on their grief journey. What's a piece of wisdom? It's not my wisdom. This is not write a book of Dr. Harrison. This is what have you gained in terms of wisdom along your own journey? What's something that you've learned about yourself and so forth? So, in a situation where we're coming up against something that I might not know, I'll say to my client, you know what? I may have to refer to my wisdom chronicle, or I need to reach out to someone else to garner additional support. And like Dee said, that helps model for them the importance of reaching out for help, but also remembering you have wisdom chronicles within yourself that you can lean into as time goes on so that you don't always have to reach out for help. I
Yeah.
found that so valuable.
And what we're seeing in our current system all the way around is we're not seeing a clear communication, collaboration. There's delay in seeing patients. There's a lot of providers, whether they're medical or in the psychology field, that don't have the space for folks. And since COVID, especially, and with the epidemic, with, fentanyl and all of that, right? We're seeing more people needing that support. So there seems to be a gap there. And so the collaboration, you're stronger as a collaborative community than you are as an island. And as on the island, you're not moving, you're not transforming your knowledge. And the world today is more dynamic than it's ever been. Things are changing and moving at the speed of light, essentially, right? And I'm going to use that Dr. Phil quote. How's it working for you so far? So if we really did a pulse check on our system, are we going to say, yes, we have A's or even B's or C's? I don't know. And we all have our experiences on both sides of this, right? Whether you're a provider or whether you're a patient or client, or even some providers that are in the system, they're like, wow, this is not efficient, right? So what I'm hearing from you as I've asked this question and from your feedback or the information you've provided is some of the benefits with collaboration are education. You're learning from each other. It's free education if you think about it.
Mhm.
And no matter what modality it is, like Reiki, it's not a licensed position. It's a certified, I think, but it is an energetic thing that helps people. It goes along with like massage therapy, right? It helps to relax a person. Sound therapy, for example, hypnosis. There's another form of quantum healing hypnosis therapy that goes back in time to analyze whether it's early childhood or even if you believe in it, past lives. Some cultures believe in that. So it helps to unpack some of the trauma and
Yeah.
face it and integrate that and heal it. The other benefit is that the patient or client is taking responsibility for their own care. In that
That's
process of learning through you, but mostly learning from this collaborative model, right? Because they're not getting spoon fed in segments. It's information that Dr. Harris, you may have a certain approach that you feel is really effective. And you're working with D, and D's like, well, this is the way I do it. But if you were to come together and collaborate with a patient, your approach might be somewhat somewhere in the middle, or a little bit of this, a little bit of that, right, as you're moving through. And so that creates a bigger strategy. So that moves me into this next area. I do have a couple of, and if there's anything that you want to add after we go through this next phase, we can absolutely do that. But I wanted to go through a couple of hypothetical patients. If we have time, we'll start with one. We'll see if we have time to go into the next. And I would like to hear from each of you a brief overview of like the process of how you would approach the treatment or therapy. And then potentially once you hear from each other, is there an opportunity to collaborate? And if so, how would you do that? And would you potentially invite someone else in also? Okay. And who would that be? So I can ask that question again when we get there after I go through this hypothetical. So just for a disclaimer that this isn't any type of treatment for any particular person, that we're merely providing hypothetical situations and showing potentially the steps of which both Dee and Dr. Harris might follow and how they would collaborate. But this is in no way, shape, or form treating any particular person's situation. And there is a disclaimer that I will also post on the podcast to follow that we're not providing any medical or health advice. This is a 45-year-old survivor of a childhood sexual abuse situation. They have carried the trauma of their abuse into their adulthood, impacting their relationships, work, overall quality of life. Some of the symptoms that this person is experiencing are intrusive memories and nightmares related to their childhood trauma. They have difficulty trusting others, struggle with feelings of shame, worthlessness, and often engage in self-destructive behaviors as a way of coping with their pain. The patient's trauma has led to a loss of innocence and a sense of safety in the world. They grieve for the childhood they never had and more in the relationships that they've been strained or broken as a result of their trauma. They've been diagnosed with depression, anxiety, chronic pain, syndromes such as fibromyalgia. So, Dee, how would you deal with this situation?
Thank you. Typically, in a situation like this, I would work with the client to really identify which are the symptoms that are most difficult for them in that moment. We can't treat it all at one time, so it's a process. And so we look at the ones that are the most intrusive, so the ones that are most difficult. So obviously in this one, difficulty sleeping, the nightmares would probably be something that we would address first. We need to, with like Maslow on his hierarchy of needs, we have to hit the base first before we can get through the rest. And part of that is also putting that person in the expert seat of their life and trying to identify which is going to be the most helpful for them. And so a lot of times I'll begin with relaxation exercises, aside from validating everything that they're coming in with, but really just helping them to self regulate. I think is going to be the most important initially. And then working on the nightmares. I do a lot of grounding techniques, which is like using all of their senses to bring them back online. A lot of times when they're in fight or flight, their amygdala has been triggered and their system automatically goes into this response that gives like false alarms. And so I try to remind them that we need to challenge those alarms and to integrate and free on some coping skills so that they know that they're the ones in charge and that they can help bring some of those symptoms down. Another thing is working on the breath work. Again, teaching them how to breathe. A lot of times when people are triggered, they're either not breathing or they're hyperventilating. And so getting them to understand how to, regulate their breathing can be really helpful. And then moving from there, I think it's like triage work, depending on what state they're in when they come to us, is to really figure out where are they at and which is the most important thing for them to address first and then go from that route.
Dr. Harris?
Yes, I often think of treatment planning in three different segments. So, in the first portion is stabilization. So, as Dee said, number one, prioritizing what they want to focus on. It looks like in this case, sleep as a foundational thing. Of course, you'd also want to assess, even though it wasn't stated with the vignette, if there are any crisis situations that we need to address. Of course, we would do that. A lot of education around sleep hygiene and helping normalize the fact that they may be feeling dysregulated, and then working with them to develop quality sleep hygiene practices and providing examples of that. Of course, linking that with trauma and grief. And so they can understand that this is a very typical manifestation of those presenting symptoms. The middle part of treatment, I would really be focused on continued psychoeducation and leaning more into creating sort of a holding environment, a container to process through whatever they've identified as priority emotions or priority functional impairments that they may be experiencing. And within that, helping them target that idea of loss adaptation. So you mentioned the trauma, there was a loss of innocence. So we might spend some time focusing on what were those losses that they perceived, how have they ascribed the meaning to that, and then coming up with a series of interventions, just reprogram some of those things. And I also, what also popped in my mind as we were reading this was reparenting. I love internal family systems, integrating some aspects of that and inner child work to help them in terms of personal agency, embrace the fact that while they cannot change what happened in the past, that they do have the skills and the tools to within themselves to reparent and address those losses of innocence. And then in the third part of treatment would be just maintenance, helping them recall again those wisdom chronicles, focusing on the strengths that they've learned the course of therapy, and equipping them to basically be able to function in their lives well from day to day.
You both have really fantastic, well laid out plans. Absolutely amazing. And whoever is seeking help from either one of you is really probably feeling very blessed. Really, it's organized, clear, but you also have, you're open to alternative types of ways of addressing this, like the reparenting process, the breath work. That's outside the box, right? That's outside the typical normal approach, I think, with care. And I think that's fantastic. Now, do you think there's an opportunity here? Like, if this is a real situation, would you see an opportunity where you could combine your knowledge and collaborate?
Absolutely. Like you were saying, Dr. Harris, it's like there are stages. And one thing that I remind patients as we work through one area, it's very common that other things will come up. And so it's like peeling back the layers of an onion, and that it's okay. It's okay for us to go slow. And so in collaborating with Dr. Harris, it would be wonderful because it would give us the opportunity to gain more additional tools for like the grief work, the trauma work and the grief work, like we said earlier, they go hand in hand because there are so many different things that are associated with it. Like you mentioned earlier, loss of identity, loss of structure, how we perceive ourselves in relationship to our family or our environment. When those things have been shaken, then it's recreating what we see ourselves as and what we thought of our lives as. And so there can also be like this cognitive dissonance, and that can create discomfort within the system as well. And so I think that working together as a team to have a holistic approach, in healing our patients is the most important thing. And again, allowing there to be space to share the work with other providers. We do that a lot in my office. I'll share with a psychiatrist or a psychologist. If somebody feels like they have ADHD and I'm doing trauma work, I'll refer over, like, here, go over there and address that area, and we'll come back. And then with the grief work or body work, sound work, all of it is really important. And being able to really lift our patients up and create a space of safety and encouragement for them, I think is really important so that they feel, again, going back to that autonomous agency that they have within them, that they feel like they can make the best choices for themselves.
I'll add here that it's probably just terribly obvious how complex these cases are. And as Dee mentioned, I think I mentioned, you'll come in with that tip of the iceberg presentation, and then all of a sudden, there's so much beneath the surface for most clients. And so I think one of the beautiful things about collaboration is that it helps you as the provider understand where you are in the case, because it's easy to get lost. We're just coming up with a very straightforward scenario, but usually there's many different things happening at once that are overlapping. And so as I've met with other providers, it's been nice to reset and, okay, where am I in terms of conceptualizing, getting input on where another clinician may think you are so that you can help the client remain anchored. There's nothing worse than a therapist who is unclear where you are and who you are in the process, especially if they're looking to us in some ways to be an anchor for them. So collaboration, as we mentioned, is absolutely critical.
That's music to my ears. And, we may not have time to go on to the next hypothetical situation, but I think the audience could get the idea of what this could lead to. And I'm going to reflect back on Ayurveda. What I'm learning is we focus in on the root cause, right? And what can actually lead to imbalances in the mind, or what we call mistake of the intellect. And typically it is stress. That's a predominant cause: stress, PTSD, trauma, depending on whether it's daily all the way to long term or from childhood. And the things that we look at are daily routine. We look at the amount of sleep. What are they eating? When are they like, for example, when are they eating the larger meal? If they're eating it to, closer to the time that they go to sleep, that can disrupt the sleep. They're on electronics right before they go to sleep. That can also disrupt sleep. So we look at the aspects of their daily life and lifestyle that can actually lead to, like even subtle things that can lead to disruption of sleep and digestion. That
Which I
potential. I'm sorry.
No, I would say, which I really love, because I think
Hmm.
that sometimes clients come into therapy and they are just so concerned that we're going to be throwing the kitchen sink at them. But to remind them that honestly, some of the most effective interventions are the simplest and the things that are God given, really: sleep, water. Are you feeding yourself? Are you eating? Are you sleeping? Are you getting social support? All of these fundamental things. Are you getting out in the sun and getting vitamin D? So
Yeah.
what we need often is already within us and around us. And it's just great to remind clients that.
Yeah. Keeping it simple first and identifying those simple things, making those slight changes. And it's difficult sometimes for people to make changes with everything all in one day or one week. It's a process. Okay, let's start with this thing first, your routine. Then we'll look at when you're eating or the type of food and go on from there. And then stress reducing practices like aromatherapy, meditation, let's see here, yoga, breath work, those different things. And also, like the other thing I've learned is a daily walk, getting out in nature, and that helps to take in the other elements and balance out the body naturally. First thing in the morning when the sun's coming up, that's fresh, what we call prana. Prana means life force. So you're actually getting a very high concentration dose of that life force in your physical body from the sun the first thing in the morning as it's coming up. It's more potent then than the other times of the day. At least that's what I've learned. A
Mhm.
lot of people aren't going, oh gosh, I want to get up at 5 in the morning and do my daily walk. But once you do that, it's almost like equivalent to the feeling of a cup of coffee. So it gets your day started and you're ready to roll after that. It's that the first getting out of bed and making that first step sometimes is the most difficult for most. I'll include myself in that.
Say, I was feeling convicted when you mentioned electronics in bed. And I think related to this is just to offer yourself a dose of grace in that,
Mm,
yes, ideally, it's good to do X, Y, and Z. At the same time, for people who are experiencing trauma and or grief, getting out of bed can feel impossible. I think Mel Robbins did this really cool video where she said her therapist said, "Hey, if you have to literally slither out of it and just slide out of bed and lay on the floor for a few seconds, crawl to the bathroom sink, give yourself some applause, even if it's noon, you did it." So really extend a lot of self grace is absolutely critical.
So as we get ready to wrap this up, I feel so grateful to have both of you on. We could go hours. And this is literally one of the most important topics today is mental health. Is balancing that is key for any aspect of life. What I would love to wrap this up with is if you have a success story that you'd love to share, it's up to you how you want to share that. Look back at maybe a client that you had, a situation rather, and steps that you walk through and the success of that process. It doesn't have to be the destination, right? But the process. Uh, Dr. Harris, do you want to start?
Yeah, I will share really more of a beautiful encounter I had with a client about a year ago. We had spent about a year and a half together processing the death of her father. And it was very difficult because of the love and the intensity of contact that she had in the best way with her father to think about grieving because in her mind, it was forgetting. It was moving on, even though we talked about the fact that it's not that. But I remember this moment where she described having lunch with a friend. And on the lunch date, as they were talking about her dad, she experienced a moment of joy. Now, prior to that, she really would not allow herself to smile. She felt a lot of guilt around laughing because in her mind it was betrayal. If I don't cling to the grief story and the pain of it all, that memory is going to fade. It shows that I didn't love my dad or the relationship wasn't what I thought it was. So she's having lunch with this friend and she experiences this moment where she's experiencing smiling and laughter and she allowed it. And I remember her coming into the appointment almost kind of like, "Ooh, I've got to tell the teacher I spilled the milk," almost as if she was in trouble. And I sat with her and thought, "Oh my God, like the fact that you gave yourself permission to allow that is such a critical thing." It wasn't as if a whole light bulb went off, but over the course of time, I could see that she was in that both and phase. And it was so gorgeous to sit across the room and see her simultaneously weep and recall these moments of joy and not feel like they were competing forces, that they really were working in tandem together. Beautiful moment for me.
Thank you for sharing that. That wow. Thank you. This is a wonderful way to start wrapping this up. Thank
Well,
you. Do you have a story?
Yeah. Years ago, I had worked with an adolescent who came to me, who had been like in and out of uh, psych wards for a good part of her early teen years. And one of the things that she had been diagnosed with was like schizophrenia and dissociative identity disorder. And I thought that was really peculiar considering how young she was. And so as I continued to do more work with her, I had asked her, well, after gathering all of the charts from the different facilities, I noticed that one of the salient things that showed up was like hearing voices all the time. But I also noticed that nobody asked who the voices were or what they were. And so we started digging into that and realized that if there weren't just voices in her head, these were the people that had abused her. And it was their words that were in her head, which is a huge difference between in hearing internal voices. And so I was able to share that she did not, in fact, have those disorders and that this was just a normal trauma response. And so some of the work that we did at that time was called Trauma Focused CBT. And she was an artist. So one of the things that we created was an art piece for her. And she had identified creating like Jack and the Beanstalk, like a vine, a big beanstalk vine. And we color coded the leaves. And as she processed and worked through the different traumas, she created this art piece out of it. And so each leaf was a memory of a different trauma, but she was able to counter it with something positive as well. And so we took something that seemed so overwhelming to her and turned it into a beautiful piece of art. And through that process, and again, collaborating in a holistic approach, we created a wraparound service or setting around her. I was invited to her graduation, and so she had graduated and went on to do wonderful things, and I was super proud of her. And when she first came to us, she was hopeless and she had been labeled, and people did not have a lot of hope in her. And it was just so beautiful to see the transformation before our eyes. And I think that's what we see a lot with grief and trauma is that the the outcome is so beautiful when we have a collaborative system that really works together to create a holistic approach to healing and that we really work well as a team. I love working as a team with other providers because we can't just do it by ourselves. Everybody is a specialist in a different area. And if we work together, we really do wonderful things, right? More hands make light work. But not only that, it's like more hands actually create a new support system around people who maybe didn't think they had it.
That's so good.
Wow. Can we just take the two of you to help solve this problem? Seriously. I'm sure there are so many out there also. I mean, I see some of the folks on Instagram, other social media that are trying to make a difference in the world. And it just seems like a heavy lift for
I
some
will
reason.
say it's an
Okay.
honor and for me, and it truly is an honor and a privilege. I feel lucky to do this work. And I tell people I wake up every day and go to work and I love the work that I do. I get to help people in their healing journey. And I think that's a gift. And not my gift, but it's a gift that we get to participate in. And not everybody is able to do this. And I think that when there are those of us that are passionate about the work that we do, um, it's beautiful.
Hopefully I wasn't causing confusion, but what I meant was it's a heavy lift to shift the system. Yeah, that's what I mean. No, I mean, I think what you're doing is,
All of the above.
is the profound. But when I look at so many people also trying to make a difference, is trying to shift things to make the difference with a collaborative approach, with working together, understanding what the other modalities are doing, like Western medicine opening up to Eastern medicine and traditional, what we call traditional medicine, holistic approaches, Ayurveda, which is included in that, psychotherapy, yoga, the wholeness, the holistic approach with mind, body, and soul, because at the end of the day, they are all connected. And so you demonstrated that today, and or at least reinforced what I feel is true in my body. So this is really awesome. So as we wrap this up, is there anything else that either one of you want to revisit or add in, expand on before we go into the closing portion of this podcast?
I'll just add along the same lines of this integrated understanding of care, in that just as we're talking about how as clinicians we cannot do this alone and that we need the support of other people, if someone in your audience is navigating own experience of trauma and or grief, to remember that you're not, it may feel as if you're alone, but the reality is you are surrounded by an ecosystem of folks who love, care, and love partner with you along your journey. You're not alone.
Well said. Dee, is there anything else you wanted to add?
I think Dr. Harris said it very well. They aren't alone. And again, feel it's an honor and a privilege to be able to provide a support network for clients. And I find that even professionally, I love to do that as well, because I feel like when we come together and share resources, then we all benefit from that and we grow together. And I want patients to know that as well, that we want healing, because as they heal, they go out into the world and they heal others too, unintentionally and inadvertently. And so it really is a ripple effect. And so to realize that there's so many wonderful things out there for them to experience as well. And I think, like I speak for both of us, Dr. Harris and I, that sometimes when we know what it's like to be in their shoes, it makes it so much easier to extend empathy and to be able to really build that trust, because they understand that we really truly do understand where they're coming. It gives
Um,
us stability.
So true.
Yeah, and being able to meet people where they are in the different areas at the different stages, right? And recognize it's easier to recognize because you, in some capacity, have experienced some of what your clients or patients have experienced. I would say the vast majority of the world has, and if they hadn't before COVID, they had now. Everyone's being affected by all of these changes that we've been experiencing over the last decade. You're right. We're all in this together. No one is by themselves. It's just being able to find the person or the group of people that they feel that they can identify with and they can trust to get that support. Before we close this out, I would love to give each of you an opportunity to share if any of the contact information you want to share, like whether it's your website, how people can find you, or any organization you're affiliated with. It's totally up to you what you want to share. And I will provide links also in the podcast link itself and on my website to your website or whatever links you would like to provide, your bio, so that folks know who you are as well.
Yeah, folks can visit my website. It's www.mikelharrisphd.com. And most of my time now is spent on Instagram, which I love. My handle's at Dr. Mikel, Drmekel. I want to share one little resource that I have, and that's how to identify a grief-informed clinician. So if you're listening to this and you're wondering, well, how do I find this person who's like D or like you or who seems skilled? Click on the link in my bio. It's a great resource, and it'll walk you through some questions that you can ask a provider to ensure that they have the tools that you need to help along your journey. Thank you so much, Kristen, for offering us the space to spend at your table today.
My pleasure. Thank you for being here.
Yes, thank you, Kristen. I appreciate it. And for me, if people want to reach out to me, my business is Strawberry Valley Counseling Services. You can look me up there and through the links that Kristen will provide. It has been an honor and a privilege to work with both of you today. Thank you so much. Thank you.
Honor and a privilege for me. I learned a lot and so blessed to have met you. Dee and I met in person this last year, actually maybe even a little over a year ago. And actually, Dr. Harris, Mikel, you reached out to me after one of my podcast posts, I think, and said, "Hey, I want to check this out." And that was awesome. Thank you. And I'm a one-woman show here where I do the podcast, editing, video, all of the marketing. So it's been a quite interesting journey in itself. Thank you so much. And I look forward to seeing how this unfolds in the future, maybe potential collaboration, if not with each other, with other folks. And also, if you are interested in coming back, if there's another way of exploring this topic, please let me know. I'd be happy to do that. Thanks so much. Take care and have a great day.
You too. Thank you. Bye-bye.
Thanks. As we navigate the murky waters of mental health, let us remember that we are not alone in our struggles. Together, we can shatter the stigma surrounding trauma and grief, fostering the culture of empathy, understanding, and resilience. In conclusion, the discussion following the podcast supports the urgent need to address mental concerns, particularly in the light of the escalating rates of trauma, PTSD, stress, and grief. The staggering statistics surpassing the 2022 figures highlight the pressing nature of the issue, exacerbated by economic uncertainty and systematic gaps in healthcare. This podcast emphasizes the importance of shifting focus from treating symptoms to addressing the root cause and advocates for a collaborative approach. By integrating various types of healing modalities used in Western medicine, traditional or Eastern medicine, holistic therapies, the providers learn from each other. They create a more collaborative structure by way of providing patient-centered root cause approach to streamline the healing processes for patients and clients. Patients and clients also are able to take ownership and determine the path of which they will heal. And I thank you so much. Take care of yourselves and each other. We are interested in feedback on our episodes and learning what topics you may be interested in for future episodes. Please follow us on Instagram, Your Health is Wealth Podcast. Also, our website, yourhealthiswealth.com, and is spelled with a Z instead of an S. foryourhealthiswealth.com. The link to the website is also found on the Instagram bio as well. On our website, we list the episodes, and there is an online form where you can fill it out, share your feedback, ask questions, share input on future topics, and also contact us if you're interested in being featured on the podcast. Topic scope is related to health and wellness. Thank you very much for listening to our podcast today and look forward to more. Have a great day, everybody. Take care.